This is the recording for the occupational English test, and this test is held at MedCity International Academy, Kannur on the 30th of September in 2023. The candidate with me is Anusha Joseph, and the candidate number is 278806. The interlocutor is Shyam, and the interlocutor number is 18532. This will be roleplay number 1 for the profession of nursing. Good morning, Anusha.
Good morning, sir.
May I please see your identification?
Yes, here it is.
Thank you. Okay, here you go. This is a test of your English language and not an assessment of your professional knowledge. Bear that in mind and speak as you would naturally in any situation. Firstly, we will go through a warm-up session to get you started. This session is not in any way assessed. First question, Anusha, why did you choose to become a nurse?
Sir, I chose nursing because of several reasons. First of all, it was my childhood dream to become a nurse. Moreover, many of my relatives are working in this profession, so they also inspired me. Hence, I chose nursing as my profession.
Okay, a very wise choice. Could you tell me about the recent trends in nursing?
Yes, of course, nursing is a dynamic profession and changes are happening on a daily basis. For instance, earlier we were using paper records, but now it has been updated to electronic records. And also telemedicine is taking a major role nowadays. So I think these are some of the trends happening these days.
Okay, that's good to hear. What's your dream destination, Anusha?
My dream destination is UK. I chose this place because it provides many opportunities, especially for freshers, and also many of my relatives are working there, so they can also help me during my initial days.
Okay. In your opinion, and this will be the last question in the warm-up session, what qualities do you think a good nurse should possess?
Of course, a nurse should possess a wide variety of qualities. But I think the most important quality she should have is good communication skills. It will help her not only to gather the clinical data, but also it will help her to maintain good relationship between her colleagues.
Right, okay. That concludes your warm-up session, Anusha. Now we will be moving on to the actual role play. I'll be taking the part of the patient or the bystander or a similar role, and you will be taking the role of the professional. The role play will last a total of 5 minutes, and you will be given 3 minutes to prepare for the same. The role play intends to get evidence of your ability to perform effective communication with patients. Do you have any questions now?
No, sir.
Okay, so you will have 3 minutes to prepare for the role play. You can make notes on the role play card if you wish to do so. Here is a pencil. Here is the card. You can look at the card as many times as you want during the role play, but at the end of the session, you will have to return it to me.
Okay.
Okay, so here is your 3 minutes for the preparation. Go. Okay, Anusha, that will be the end of your preparation time. Now we will move on to the actual role play. You can begin from now.
Good morning.
Good morning.
I am Anusha. I will be the attending nurse today. If I am not wrong, you are Sarah's mother, right?
Yes, I am Sarah's mother.
Okay, for my better communication, could you please tell me your name?
Of course. My name is Jennifer.
Okay, Jennifer, I am glad to tell you that your child is being discharged today from hospital, and she is having a cast above her knees, right?
Yes, she has been fitted with a knee cast.
Okay, let me know that do you have any idea about the cast management at home after discharge?
Well, I don't know much. The only thing I'm aware of right now is that the cast should not be disturbed or damaged in any way.
Okay, what you have said is right. I appreciate that you have some knowledge about cast management at home.
Right.
But apart from that, there are other methods also which you need to take care of. Is it okay for you if I explain more about that?
Yes, yes, please do explain everything to me.
Okay, first of all, it's very important that the cast should be prevented from getting wet.
Okay.
So I meant that when you are giving bath to your Sarah, this cast need to be sealed in a plastic cover. Are you getting me?
Yes, yes, I understand completely.
Okay, also it's very important to limit her mobility.
Okay, okay. I think that would be a bit difficult for me to do because as you already know, my daughter, she's only 2 years old, and it would be very difficult for me to prevent her from trying to walk, and it would be very difficult, even more so, to monitor her all the time. So I don't know how that will work.
Yes, Jennifer, what you have told me is absolutely right. So Sarah is only 2-year-old, and it's a 2-year-old child will be active always.
Yes.
So I can really understand your situation, and I know that it will be difficult to manage her. But there are some ways which you can limit her mobility. Is it okay for you if I explain more about that?
Yes, please do explain.
Can I proceed?
Yes, please proceed.
Okay, as Sarah is having cast on her legs, so it will be difficult for you to, it will be difficult for her to walk with that cast.
Right.
So naturally she will try to crawl on floor.
Okay.
Are you getting me?
Yes, yes, I am.
So it's important that you can spend some, I advise you to spend some time playing with her.
Okay.
Or telling some stories to her. This all will help you to limit her mobility.
Okay.
Are you doing any such activities at home?
Yes, usually we do. I do read her stories from storybooks, and I try to play games with her.
Okay, that's good. Try to continue that activities. And also make sure that Sarah is always kept on a pram while going outside. So it will prevent her from walking.
Okay. all right,
Okay. How does that sound?
That sounds great. Could you tell me if there are any symptoms that I need to watch out for during her time recovering?
Yes, Jennifer, I appreciate that question that you have asked me. Yes, there are some, as you have said, there are some situations which you need to be very you need to take care of. I will explain more about that.
Okay.
The situations like when Sarah is complaining about increased pain, or when you notice some color changes in her toes, or if she is telling any sensations like pins and needles. In such situations, it's important to inform doctor as soon as possible.
Okay.
Are you getting my point?
Yes, I do get your point, but this seems a lot to manage with. I'm finding things very difficult to understand, and I'm feeling a bit overwhelmed with all these things I have to do.
Yeah, Sarah, I can really understand your situation, and it's very difficult to manage a two-year-old child alone. So, do you have any other members in your family who can help you in this situation?
Well, my husband doesn't work close to home. He's away a lot, so I'm the only person taking care of Sarah.
Is there any other members who can come to your home to help you?
Well, I think if I were to call my mother, Sarah's grandmother, she should be able to come home and stay with us for a while until she recovers, yes.
Okay, Jennifer, that's really good. And I suggest you to call your grandmother, so she can also help you to take care of Sarah.
Okay, Anusha, that concludes your speaking test. You may return the card to me now.
Okay.
Thank you.
Thank you.